Preventing type 2 diabetes is the reason why I'm doing what I'm doing. As in, why I have gotten as much information as I possibly have, why I make these videos. This video is going to be a little long. Preventing type 2 diabetes is very, very important to me. Why? Because type 2 diabetes killed my mother. Before she died, she was on, I think, the highest dose of insulin possible. She lost 2 of her toes due to neuropathy. She had neuropathy because of type 2 diabetes. And she had type 2 diabetes because she was insulin resistant. And she was insulin resistant for many, many years. And she was insulin resistant because of her lifestyle. Her lifestyle gave her a disease that she did not have to have. And that disease took her life. So I had to get as much information as I possibly could to make sure that what happened to my mother doesn't happen to me. It just so happened that while I was getting the information, came to find out that I was pre-diabetic also. So I got to use what it is I learned on myself. And since then, I reversed my pre-diabetes. I reversed insulin resistance. I lost 51 pounds. I lost all joint pain that I had. I used to take ibuprofen every single day until about a year ago. So about 2 years ago, I found out I was pre-diabetic. Now, the videos that I am making today, one is to keep myself accountable, and 2 is to share the information that I should have been giving to my mother. Everything in my videos is basically what it is I would have said to my mother so that she would be alive today. Because I believe that if I knew then, 7 years ago, what I know now, my mother would still be here. I believe that. I honestly do. Because she died from type 2 diabetes. Understand what I'm saying? Now, today, with the videos, I hope that the message that I'm sending will at least give you all enough information, make you understand how important having a yearly physical is. It is very important. A yearly physical will help you to see if you have a disease, specifically a lifestyle disease, a preventable disease developing within your body. I also hope that the information that I'm sharing with you will help you when you're sitting in front of your doctor and your doctor is speaking to you, especially when it comes to lifestyle diseases like hypertension, type 2 diabetes, non-alcoholic fatty liver, even heart disease, PCOS, erectile dysfunction, even high cholesterol. When you're sitting in front of your doctor and your doctor says to you, as in for type 2 diabetes, you're pre-diabetic, I'm going to put you on insulin, you can say to your doctor, Doc, I'm a type 2 diabetic. You just said I'm pre-diabetic, so it means that I'm type 2 diabetic, right? I'm going to be a type 2 diabetic. As a type 2 diabetic, Doc, I have too much insulin inside of me. Why do you want to give me more insulin? Or if the doctor says to you that you are a type 1 diabetic, I'm going to have to put you on insulin. You can say to your doctor, Doc, I understand that I'm going to be on insulin probably for the rest of my life, but, or even if it's your child, this works for your child also. But, Doc, I also understand that my lifestyle is going to determine, as a type 1 diabetic, how much insulin I'm going to take. So if I adopt a low-carb diet, it means I have to take less insulin. Understand what I'm saying? Now, hypertension, same thing. If your doctor's sitting and he tells you that, listen, your blood pressure is high, I'm going to have to start putting you on this medication. If your doctor looks at you, women, and say, you have PCOS, I'm going to put you on this medication. Men, erectile dysfunction, I'm going to put you on this medication. cholesterol. Your doctor says you got to start using this statin. Well, specifically for cholesterol, let me make a side note. Before you take any statin, ask your doctor to check this artery here, because this one leads to your brain. Find out if there's calcium there. Let him check this artery here because it leads to your heart. Understand what I'm saying? Because if there is no calcium, why are you taking a statin? You shouldn't have to take a statin if there's no calcium. Understand what I'm saying? LDL cholesterol is not a disease. I am not taking a drug if I have no calcium here and no calcium here. I'm not preventing anything. If my LDL cholesterol is high, maybe it's high because I'm healthy. Understand what I'm saying? But back to the other ones. When you're sitting in front of your doctor and they said that you're pre-diabetic, you have PCOS, you have erectile dysfunction, when they say your blood pressure is high, before you're given the medication, you start taking the medication that's given to you, ask them if fasting and eating low carb are good ways for you to naturally lower your insulin and your sugar and your blood pressure, to reverse PCOS, to reverse erectile dysfunction. Ask your doctor. You have information. I am sharing information so that you could sit in front of your doctor and say, Doc, I believe that I can reverse prediabetes. I can lower my blood pressure. I can reverse PCOS. I can reverse erectile dysfunction by changing my lifestyle. Intermittent fasting will naturally lower your glucose, which means it will naturally lower your insulin. Understand what I'm saying? These things will naturally lower it. And I'm not leaving out the people who are overweight. When you sit in front of your personal trainer, your dietitian, your nutritionist, and they look at you in the eye and they say, oh, well, yes, eat less and exercise more. Tell them, nah, I'm not going to do that. All I'm going to do is control insulin. Because if I control my insulin, my weight will go down. If you control your insulin by controlling what you put in your mouth and by fasting, you control your weight. You reverse insulin resistance. You reverse prediabetes. As long as your pancreas is able to make insulin, you will reverse type 2 diabetes. PCOS is gone if you control your insulin. Intermittent fasting works to naturally control your insulin. It's free. Eating low carb, you are going to go to the grocery store anyway. Understand what I'm saying? You're not coming out your pocket anymore. And at least 4 days out of the week, you get up and you go exercise. I hope the videos that I'm giving are informative. I hope that everyone's getting use out of it. Have a great day.